It was a startup. It was an East India chain, very well established, but it was coming into North India, and they were establishing in Delhi. I joined them right from ground zero. So it was my first experience, and that was it started as an entrepreneur journey. Senior residency is a prerequisite for faculty positions all over the India except a few states.
Mm.
And if you are missing that, you are closing that door. You don't know what is going to happen. We started from zero, and when I left the place, our sample processing capacity was 9,000 per day. I set up a robotic lab for
Oh,
molecular. And it always keeps on demanding funding. Being an entrepreneur is never a thing that you can rest. Maybe the second generation can rest. Investigations like PCR, FISH, fluorescent in situ hybridization, or for that matter, NGS, that is gene sequencing.
mm.
These investigations come under molecular pathology.
Got it.
Immunoanalyzer in pathology lab, which will cost you only around 70 to 80 lakhs, can give you 6,000 reports in a day. But because of lack of education, if the graduates watching today realize that we need regulations and then wait for the regulations or push for the regulations or call for regulations and government actually implements them, then pathology will change overnight. It will become the rank one branch. Sir, I'm promising you that. He left AIMS being a faculty. He was MD pathology with me, became a faculty in AIMS, took FRC path, went to UK, stayed there 2 years, came back and joined back India again. These kind of things are doable.
Your recommendation is first start small in tier 2 or tier 3, one center,
Yeah,
prove your worth and your capabilities there, slowly expand to another
slowly.
center. Hello, all. This is Dr. Dheeraj Masapu, and today we have Dr. Asif Iqbal with us, who has done his MD in lab medicine. And after that, he has wore several hats, and he worked as a senior resident, and then he actually went to Saudi Arabia and worked as a consultant there. And at present, he is actually the founder of Healthica Labs. And welcome to the channel, Dr. Asif Iqbal.
Thank you very much, sir, for letting me be a part of it.
So,
And you're doing a great job, sir.
so
Commendable.
Thank you. So basically, this video is about if what is the suggestion that you would give to your younger self if you are sitting in the NEET PG counseling. And a person sitting in NEET PG counseling, if he needs to choose MD lab meds or MD pathology, what is your suggestion? And we want it unfiltered and with open heart.
Thank you very much, sir. Sir, I am Dr. Asif, as you've said, and I have now 11 years of experience post MD, and I've done MD in lab medicine from AIMS New Delhi. I've spent more than 6 years in AIMS New Delhi, and now the purpose that you are doing this is to guide the young doctors who are not actually second generation doctors, who don't have the proper guidance, who don't have doctor background or parents or anybody else who can guide them. And the situation is much more scary for the fresh doctors because when we are doing our MBBS, all we have our eyes on are like the fantasy world. Oh, I want to be a heart surgeon. I want to be a neurosurgeon. I want to be this and that, and that's all fantasy. We don't understand what are the implications and what we are good for or what we actually want to do. It's all really, it's just speculation and fantasy, everything. But making informed choices is very, very important. I really wish I had these videos and this guidance when I was back in my MBBS. And I would like to add here one thing. The only person happy in life is the one who makes informed choices and he is clear in his concept. Because once you start to regret, had I done it differently, had I done something else, then your life is really miserable. It's not good. And making informed choices and having a clear concept is the key to real peace. I have seen people very happy. I have a friend of mine, very, very happy in MD biochemistry. Actually, when we were preparing for MD, I asked him, what do you want to take? We were preparing for MD. Everybody has a goal. And I asked him, and a guy, and 1 year senior to me, and I asked him, what is your goal basically. He was like, I'll take anything paraclinical. I was like, what? You are the first guy whom I have met who's saying actively, I'll take anything paraclinical. I said, why so? I don't want to deal with patients. I was like, you are a doctor. Well, yes, I am a doctor. I'm a conscious doctor, but I don't want to deal with patients. And okay, I was like, okay, hypothetically, you get a very good rank. You have all the choices. Still, what? The highest I'll go towards clinical is anesthesia. I'll contact the patient when he is out. And I was really, that was unbelievable for me, what was coming from his mouth.
He's smart fellow, actually.
He actually faked biochemistry. He studied only so much that his rank was only such. He got biochemistry in that attempt itself. He took, right now he's settled in Dubai, doing
Mm.
10 times better than me and 100 times happier than me.
Oh, superb.
The point is always, it's not about the branch. It's about what you want to do, what is clear in your mind. Now coming to lab medicine and pathology.
Just I want to
My
add
journey,
one point here.
yes,
So
sir,
what you're
please.
trying to tell
Please, sir.
is take informed decision by yourself and enjoy it. That is what you're coming to, correct, no?
Exactly, exactly. And when you take informed decisions, when your concept is clear, you will enjoy it. Whether it be biochemistry or it be CTVS, you will enjoy only when people are miserable in neurosurgery.
Mm.
All the neurosurgery residents which I know are miserable. Oncosurgery residents always miserable. Oncology residents always miserable. Always miserable.
Because
And it is
people only see the success stories. Unsuccessful people they don't
exactly,
see.
exactly, exactly. It is so. And paradoxically, I'll tell you another incidence of when I was doing my MD, and I had a senior who was a pathology resident. And when you see, look, everything is not for everyone. One person likes dosa, another one likes butter chicken. It's and we cannot say dosa is better or butter chicken is better. We cannot say that. It's a matter of what your perspective is. So
Perfect.
it is the same. It is the same. My journey, I took up lab medicine, not because this was my goal. My goal was surgery. Always. Whenever I was, since I was a kid that I want to become a doctor, I want to become a surgeon. But I took lab medicine. Why? Because when I got selected in in the AIMS and the rank was out, that time it was only AIMS. And today there are many. At that time, what my rank was not good for surgery. Today it may be good for even radiology, but at that time it was not good for surgery. The options which I had, lab medicine stood out from them. And when whatever limited information I could gather, lab medicine stood out. And I compromised everything, thinking that this is AIMS, and it was just fresh out of my finishing up after my internship. And I was very happy, and I was feeling very lucky that okay, I did not waste any time, and now I am selected in AIMS, and I'm getting a chance of lab medicine, so I have to compromise something. And I made that compromise. Okay, I entered lab medicine. And as soon as I entered lab medicine, within first year, I understood what pathology or lab medicine is about. And I made a decision that I want to be an entrepreneur. Today or tomorrow, I will end up as an entrepreneur and I will establish my own setup. And keeping that in mind, I made another wrong decision. Again, there was no one to guide me. That I decided to not go for senior residency and I will start my private sector journey right here after MD. And I consciously did not give senior residency exam and went into the private sector. Luckily enough, when I joined, it was a startup. It was an East India chain, very well established, but it was coming into North India, and they were started establishing in Delhi. I joined them right from ground zero. So it was my first experience, and that too, it started as an entrepreneur journey.
So it's a job,
Establishing
not a founder. It's a job in the diagnostic
it
chain.
was a job. It was a job, but I was at ground zero. The lab was not even basically nothing was done,
Mm.
and the only concept was ready, and we were starting.
Mm.
So that was my first tutoring into the entrepreneur world, and it went very good. I got very good experience. But simultaneously, the guidance which was supposed to come earlier started coming late. That do not miss senior residency.
Why so?
Whatever you want to do in your life, because when you are doing this, you are closing doors. Senior residency is a prerequisite for faculty positions all over the India except a few states.
Mm.
And if you are missing that, you are closing that door. You don't know what is going to happen in your life. And senior residency is not just about making a requirement complete. No, it's not. When you are doing your senior residency, you actually learn real work in senior residency. In MD, you are studying, you are getting the hang of things. Senior residency, you are actually free-handed implementing them.
Got it.
That too in such a big setup. And that too, I could have gotten senior residency in AIMS.
Mm.
And that is the best place you can get your free hands experience on. It took me 2 years to realize that okay, senior residency is important and whatever I want to do can wait 3 more years. I decided to come back to AIMS after 2 years and did my senior residency.
Oh,
After that, luckily enough, as soon as I finished my senior residency, I got an offer from Saudi Arabia and in Ministry of Health as consultant clinical pathology. And I went there, but as soon as I reached there, it was COVID. COVID
mm.
released, and I did not do much pathology there. But luckily, I got pulled into molecular pathology for COVID investigations. And but 6 months I worked as a first responder physician. Then I started in molecular pathology. So first year went like that. And due to personal other problems and everything, I couldn't stay there. Again, the choices were just spontaneous as they come. There
Mm.
was again my entrepreneurial journey started revolving in my head
Got
that
it.
I'm not doing what I was supposed to be doing.
Mm.
And in just 1 year, being dissatisfied, being in Saudi Arabia, earning much better at a good place in Ministry of Health in a government job, still I wasn't satisfied. And this is what happens when your concept is not clear. And I came back, leaving everything in just 1 year. And again, I got a good offer. I got being offered as director for Tata 1mg. They knew that I established, I did molecular in Saudi Arabia and everything. And when they found out, they said we are establishing and we want to go about our molecular establishment. And I joined Tata 1mg as director and I established the whole molecular division and microbiology division of Tata 1mg. And Dr. Masapu, this is a place where I'm really proud of in my life. When we started, if you don't know the molecular world,
Yeah.
the molecular world is like the Hollywood of pathology sector right now.
Okay.
Molecular is the upcoming thing. Okay. And it is difficult. It is very difficult. We established, and from zero, we started establishing in second wave of COVID, before second wave of COVID. We started from zero, and when I left the place, our sample processing capacity was 9,000 per day. I set up a robotic lab for
Okay.
molecular. Also, when I was there, Tata uh, developed a novel COVID diagnostic procedure, which was based on a gene editing tool called CRISPR,
Okay.
CRISPR. And it was a novel COVID diagnostic technique. I standardized it commercially and I released the first report of it. And I established the whole robotic setup of CRISPR with 4,500 sample processing capacity per day and
Okay.
4,500 other conventional way, normal PCR. And this is what I could do in Tata Banerjee, and running it through second wave was really brutal.
Mm.
And the working in that second wave was really what a roller coaster journey, what a tough journey, really.
Yeah.
And again, it inspired me because it was lingering in the back of my mind that if I can do this for somebody else,
Mm.
why not do it for myself?
Oh,
And that is where I parted ways and I established Healthica Path Labs. And luckily, we established Healthica Path Labs. They had unlimited budgeting, funding. I
I
started on
want to
my own
interrupt you
with my
once. I want to interrupt you here. See, but in Saudi Arabia, you would have earned more money, I think, than in.
much more, sir. That's what I'm saying. I was earning much more. I was a very much better place. But again, the same thing that I want to be an entrepreneur. What am I doing
Happiness.
here? And I was homesick, a bit homesick. But when you are not clear in your mind,
Mm.
every small thing becomes a reason.
Correct.
I'm homesick here. I was supposed to be an entrepreneur. I'm in a job, stuck in a job here, and all these things keep kept coming to my into my mind, and I came back.
Got it.
And after that, doing Tata 1MG again gave me the same motivation that
Mm.
when I can do this for somebody else, why not do it for myself? And at that time, I took a decision of start going on my own. I parted ways with Tata 1MG very soon, and I established my own molecular setup. And the place where I set up in that district, that part of the district, I was the first NABL lab, first molecular lab, and first COVID lab.
Oh,
And we also went on to become the first private vaccination center of that part of the
okay.
district, COVID vaccination center. And we got empaneled into Delhi state, Haryana state for COVID testing. So it was a success at that
Okay.
time. It was a real success, and it went very good till that time. After that came another challenge in life
Mm.
because now, viewers, please understand this. Being an entrepreneur sounds glamorous, sounds that you're making a lot more money and the life is very good. But it has its own struggles, especially when you're first generation. If you are really first generation, I would advise against it because now when you are into an entrepreneurial journey, if you're a clinician, it's a little bit different story. When you are paraclinical, pathology has been commercialized, and the giants, the big corporate giants which have come into the pathology sector, have made it further more difficult because with entrepreneurship or a pathology setup now classifies as a business. And for any business to grow, funding is always important. And it always keeps on demanding funding. Being an entrepreneur is never a thing that you can rest. Maybe the second generation can rest, but the first can never. First can never. You have to be always on your toes. And the moment you lean back into your chair, the moment you lean back into your chair, it starts to go downhill. And funding is always required. It always takes more funding to go further. It always requires more funding to go further. And that becomes an exercise, a continuous exercise, which drains you. And especially due to the corporatization of pathology sector and lack of regulations, have made doctors not as relevant as in other fields of medicine. Now, to the young viewers, which I want to say, even if you want to take anatomy, be clear in your concept. There are so many things to do in anatomy, in physiology, in pathology, that if you have a clear goal, if you have a clear mindset, then you can do wonders in any branch. But since I'm a pathologist, I'll restrict myself to that. Dear graduates, when you are in MBBS, what are the reasons you should take up pathology? First, you want to avoid emergencies. First reason. You want to have a peaceful life. Second reason. Your goal, primary goal, is not a lot of money, and you can be content with much above average, but okay, limited money. Fourth reason is if you want to really avoid patient contact and you want to limit that, what all can you now when you have made a choice because of these reasons? Last reason, you are confident, you are a second generation doctor, that you can be an entrepreneur. Then, for being an entrepreneur, in a way, this is the best choice, which I'll explain later. Now, where now we come back to our initial reasons. Pathology is a peaceful branch. It doesn't have emergencies. You can have good working hours and a good work-life balance. And coming to expertise, it's not just MD. After pathology, you have options of DM hematopathology, DM clinical pathology, and upcoming world in upcoming diagnostics. pathology has pathology is evolving very fast. I'll come to the current scenario of AI also in this. Pathology is evolving very fast. The part of clinical pathology, the biochemistry investigations, they are becoming redundant. The role of pathologist is becoming redundant in those fields. Where doctor now where doctor should aim to basically improve himself or herself in the field of pathology is gaining very specific skills which cannot be turned to technology, which cannot be, which are not dispensable. Now, those are molecular pathology, those are histopathology, lab management, quality control. These fields cannot be automatized.
No, no, small interruption. Like, what is molecular pathology? Multiple times you are emphasizing on that. In one
Exactly,
line, can you briefly explain us?
exactly, sir. For very layman example or MBBS undergraduate level example, investigations like PCR, FISH, fluorescent in situ hybridization, or for that matter, NGS, that is gene sequencing.
Hmm,
These investigations come under molecular pathology.
got it.
And these investigations are becoming very much rampant, especially in oncology part and many other diseases as well,
Even we sent
infectious
in neuro
diseases.
after CSF sample, we sent for tuberculosis PCR.
Exactly. This year. And it is the most definitive, most sensitive,
Yeah.
most reliable investigation. And uh, this is the future of pathology, basically. And now, oncology, so basically, you cannot move ahead. In most of the oncologies, you need gene sequencing and PCRs for genes, presence of genes and all. So, this is a very important field. Histopathology, again. And in histopathology, the expertise can reach up to level of a surgeon. That a histopathologist can go up to that level. And when a person makes this choice of pathology, it should be clear, very clear, that I need to develop myself in such a way that I have to have some unique skill which makes me indispensable. If I'm stuck to basic pathology and clinical pathology and clinical microbiology, then I am dispensable. I am with the crowd. Secondly, now we come to entrepreneurial journey. If you really think that you are that person and you want to go in that field, be ready for at least 20 years of stress. First of all, clear your mind that 20 years it will take. Only your next generation will reap the rewards. Because by the time you will be able to relax, you will be in a relaxed state. You won't be energetic enough. And when the second generation comes, they will get the reward of it. Secondly, you should have financial backing. You should have that. You should be ready for a time that, okay, take 10 years to get the rewards back. Thirdly, in today's world, I will still advise against it because there is a rapid corporatization of pathology going on. Now, why is pathology attracting so much of corporate input? Because radiology and pathology combined make the diagnostic world, and they both are sister branches. Without radiology and pathology combined, no diagnosis is complete. But why doesn't the corporate sector go towards radiology and why it is coming towards pathology? Radiology, because of two reasons. First is a financial reason. Radiology is a very, very, very costly branch to set up. One decent MRI machine costs 4 crores. One decent CT machine costs 2.5
I'll tell
crores.
you, we are getting 3 Tesla MRI. It is
Yeah.
15 crores.
Ah, yes. Yes. I was going to the lowest. I was starting
Yeah.
from very, very, very low below. Yes, it is 15 CR. I know that. And the advanced machines nowadays are so costly. The capex in radiology is very, very high. That is the establishing cost. It is very, very high. And the return is not so much. Okay, even if you run your MRI machine at full capacity for 24 hours, you'll be able to cover maybe like 5 patients per hour. Do the maths. Whereas you take a decent immunoanalyzer in pathology lab, which will cost you only around 70 to 80 lakhs, can give you 6,000 reports in a day. And again, I'm not going into the strict financials. What I'm just trying to give you a picture of is just this example. A 1 crore machine giving you 6,000 reports, and a 15 crore machine can give you maximum 300 reports in a day. So you can understand the difference.
Yeah.
Secondly, in India, unfortunately, this is the injustice being done to the pathologist community. I'm telling you statistics released by Dr. Lal Labs. The government statistics made aware by him. In India, around 10 years back, I'm talking about, there are some more than 3 lakh pathology labs running. Okay? And at that time, there were only 4,000 MD pathologies out there in the field. Now, can you imagine how's it going? You very well know, and
Yeah.
all of us know that whenever we go to any city, for that matter, even in metropolitans,
Mm.
people with 10th or 12th graduate people are running labs, and there is no exact statutory control on them. Advisories have been given, but they are just advisories. It is not law in action.
Mm.
Whereas in radiology, due to PNDT Act, it is even impossible to buy an ultrasound machine.
Yeah.
And you can buy an X-ray machine being an MBBS. That's it. You
Got
cannot
it.
go beyond that. And because of the tighter control, the demand of radiologists and pathologists vary greatly, and that reduces the value of a pathologist. It's not that in terms of expertise, pathology is no way second to radiology. In no way. Pathology is much more diverse. It is much more diverse. But because of lack of education, if the graduates watching today realize that we need regulations and then wait for the regulations or push for the regulations or call for regulations and government actually implements them, then pathology will change overnight. It will become the rank one branch. Sir, I'm promising you that.
Yeah.
If proper regulations are placed, pathology will become rank one branch
Because
because it
obviously,
is
because
better than radiology.
lakhs of labs are there and thousands of pathologists are there. There is a discrepancy. No? If somebody files a
Big,
court
big.
case, then it will be, you will require, I think, 4 lakh pathologists overnight.
So cases are going on. The private bodies of pathologists have filed cases. They are going on, awaiting decisions since long.
I
But
can understand.
and sir, now we coming back to this topic.
Yeah.
If pathologists, if you make this decision in your MD, I gave you a list of reasons.
Mm.
If these are not your reasons, if your reason is okay, my rank is fit for pathology,
Mm.
or it is an emergency-free branch, I should take it, then you will regret it. Then you will regret it. If the concept is clear, your roadmap is clear, what I want to do, where I want to be, then basically you have then you have a very bright future in this branch.
Got it.
I'll another give you another example of my senior who was with me when I was doing MD.
Mm.
He was doing a senior residency, and I asked him. He was preparing for DM hematopathology,
Mm.
and I asked him, "So, what is the need?" Basically, because when you are a pathologist, you have a whole field. You can do clinical pathology, you can do molecular pathology, you can do histopathology, cytopathology, or lab management, everything. You can do everything.
Mm.
But when you take up DM hematopathology, what doing DM does to you,
Mm.
first of all, in the way he explained it to me, that it increases your ego first,
Mm.
rightfully increases your ego because doing a DM is not at all an easy job.
Mm.
First of all, scarcity of seats, age at the person where the person is at that time. We have a very long curve of study in our field. And when a person does a DM, it first of all increases your ego. That if I am doing DM neuroanesthesia,
Mm.
then I will. prefer to do practice neuroanesthesia. I
Obviously.
don't want to do all anesthesia.
Yeah.
I have studied for this.
Correct.
Okay. If a case comes to a neuroanesthesiologist that, okay, we are removing a appendix and please come to us, so you will say, okay, there are many anesthetists for that. You don't need me.
Yeah.
You don't need me.
Correct.
The person will say that only. So when I asked him, sir, why are you preparing for DM? It will narrow down your field. You cannot
Mm.
do much of the things. You won't be hireable. It will be very difficult for you to get hired. And he said, I'm doing this for ego. I
Mm.
said, please explain. He was like, after my MD, I thought of becoming an entrepreneur. And I said, yeah, I'll be an entrepreneur. And I went into my hometown and established a lab. And when I established a lab, I needed samples. And for getting samples, you need to network out with doctors
Yeah.
that I have come up with a lab and please send me samples because it is a dependent branch. And that is the most horrible part of this branch, that you are dependent. And he said that I was trying to network with doctors, connect with them, making them aware, which you have to do. All the entrepreneurs have
Mm.
this in mind. You will have to do this. That he went to a doctor and he was not an MBBS doctor. Maybe he must have been BAMS, BUMS, BAM, or whatever, BIMS. And he had a good practice. And my senior went to him to meet him. And he made him wait for around an hour in the lobby to give him time. And he said, I was sitting there and I was thinking, after doing MBBS, after doing MD, I'm sitting here like a salesman, like an MR, and waiting for this guy to give me 10 minutes of his time. And I've been waiting since so long. And he said that I felt very bad. And I said, I don't want to do this. And that was the turning point. I shut down the lab and I came back. I took senior residency. I applied for senior residency in AIMS. I got it. And now I'm going for DM hematopathology. Today he is faculty in AIMS Jodhpur
Mm. Got it.
after doing DM hematopathology. But and in his journey also, after doing DM hematopathology, he qualified DM hematopathology. After doing DM hematopathology, he did not get any because now, as soon as you do DM, you
Mm.
become very less hireable
Correct.
because you have an ego and places to satisfy you, to
Mm.
actually need you, to actually put you to use are very less. So he had to join a routine pathology private lab
Mm.
as lab head. And that was again his nightmare and his employer's nightmare as well. Because he wanted to do things at a certain level. And in private sector, that level is costly. And where the cost comes, you can understand.
Yeah.
He spent 1 or 1.5 year there, but that was bad for him and his employer both. Finally, he reached where he wanted to, and now he's happy. Earning much less than a private practicing pathologist or an entrepreneur for that matter, but he's happier. And he's happier. In the end, it is happiness. If your concept is clear, his concept was made clear, he adopted that clear concept, and now he's happy. Young doctors, please remember happiness doesn't come by money. Happiness doesn't come by the choice of your branch. So please don't think that if you are in orthopedics or if you are in radiology or if you are in CTVS, you will be happy. Being in CTVS will make you so less hireable that you cannot imagine. Being a general surgeon will keep you much more hireable. And that doesn't mean that a general surgeon is happier. No, it doesn't. A general surgeon also faces a lot of competition. And similarly, whenever you make a choice, pathology is an excellent branch. If your concept is clear, if you know that, okay, I want to excel in histopathology or I want to excel in molecular pathology, this is the branch for you. It will leave you without emergencies. You will have lots of time to spend with your families or on yourself. You will have a very good, reasonable amount of money in which you can lead good life, and no amount of money can buy real happiness.
Got it.
And if you want to be an entrepreneur, buckle up. Take Remember that okay, it's a 20 years journey. My next generation will reap the rewards. And do your part. Be clear that you will have to network. You will have to ask the samples. You will have to keep on infusing money in it. You have to know that it is not easy. It's not that yeah, I'll spend few lakhs, establish and earn and put in. No, it won't go like that. You have to invite fundings. If the concept is clear, if you know all this, and if you know that I don't want emergencies, I want less patient contact, make a decision. Pathology is better than radiology, provided those regulations taken.
Got it. So
And pathology is better than radiology if the capex is limited, if the finances are limited.
So now you're saying that after MD pathology, we can better to position yourself in molecular pathology or some specialized area which cannot be replaced by technology. That is what
Exactly. Coming to
that is for
technology,
job
coming to
mindset, not for entrepreneurial mindset. For job you're telling, correct?
for job minds. Coming to technology and what technology might interfere in pathology. Clinical pathology, clinical microbiology, clinical biochemistry. Now these things are becoming these reports. The interpretation of these reports is the job of a pathologist. But these are very much numbers. And now we are living in the era of an AI. This opens up another field for a pathologist, but also cuts down the field of many pathologists. All the old-fashioned, old-trained pathologists might very well, who are practicing clinical pathology, might very well be replaced by AI. Because if it is interpretation by numbers, then AI can do it. Remember, AI can do it. If it is not here today, it will come. It is definitely going to come. It is in talks everywhere. In the whole world of pathology, it is in talks. That the algorithms can be developed where they can interpret these parameters and give a picture. And if the doctors don't have this in mind, are not up to date with AI, what algorithms can do and what we can do, your role, which can improve yourself, make yourself an AI expert. Know that how you can give 1,000 clinical pathology biochemistry reports in 1 hour. How can you utilize AI to interpret them, to filter them out, to really divert your attention where it is really needed, and how you can use this. If you become an AI expert passing pathology today, you really, really have a very bright future because it is coming, it's not going anywhere. So, this opens up one another field. AI might take place up, but you can again become a person who knows how to control it.
So
And
AI
that is
will
where
help
another
entrepreneurs,
place.
I think, like you mainly because you can cut down the cost of operations basically.
So, the cost of operations cannot be cut, the cost of pathologists can be cut.
Cost of pathologist because that is the main.
Pathologists.
That is one of the cost for like when you're running
Exactly,
multiple things.
exactly, exactly. So, that is where I say. So I would say these all are the regions, these are the places, and these are exactly the factors which you must take in when you make a decision. And again, no decision is a bad decision. You take a decision, you make it good if it is conscious, if it is informed.
So, so now I understood. So even for a job mindset, there are good opportunities. I did a little bit of
Yes,
research about abroad opportunities in Australia and other countries. So they, in some centers, they're asking for oncopathologists in Australia. In some centers, they're asking, different types of super specialties also. Demand is there now abroad.
sir, I've done that also. The demand of pathology in countries abroad is good. Indian curriculum is good. But we in India lack on one thing. Our MD is based on British curriculum, which is 3 years. But rest of the world goes by American curriculum where
Or
MDs are 4 years. And that provides a problem of equivalence. Majority of countries accept the MD pathology and the equivalence is fine. Now, when you mentioned Australia, UK, or US, these countries, in UK, the journey is easy. You have to become a fellow of the Royal College of Pathology or hematology, and you can go ahead with that, which is not a very difficult thing to do if you have done your pathology properly. Again, keep a clear concept right from the first day when you're entering. I want to do FRC path after this. Start preparing from your first year.
Mm.
By the time you finish MD, appear for FRC path also, get both the degrees simultaneously, and your journey is clear.
Yeah,
I have a colleague again. He was faculty in AIMS. He left AIMS being a faculty. He was MD pathology with me, became a faculty in AIMS, took FRC path, went to UK, stayed there 2 years, came back and joined back India again.
got it.
So, sir, again, it is about the concept and the plan. If it was clear that I want to do this, first he became faculty in AIMS, he didn't like it, I'm not doing a good job and this and that. He went to
Mm.
UK, did a Farsi path, joined there as a consultant, and then came back.
Why did he come back
Sir,
then? He was settled there, no?
sir, I really don't know. I really, after hearing about the decision, I didn't have the courage to ask basically.
Okay, okay, got it.
Coming to the countries like Australia, Australia will not recognize your pathology as such. But
Mm.
if you have done your pathology properly, they give you a jump start.
Mm.
They can get in, you can get into their residency program,
Mm.
and they will give you a jump start of 2 or 2.5 years maximum.
Yeah.
Maximum. At least they will give you a jump start of 1 year, at least. And if you get that jump start, sounds a bit demeaning or derogatory that they don't recognize your MD and they will not give you equivalence. But getting a jump start of just 1 year in Australia,
Mm.
it will put you miles ahead.
Correct.
Miles ahead. It is very good. You plan a country. I want to go to US after pathology. I want to go to UK after pathology. I want to go to Gulf after pathology. Going to Gulf, you don't have to do anything. Just be good at histopath, cytopath, or choose an area, oncopath, nephropath. Become good at it, you will be taken well, in arms, no
Yeah.
problem. If you want to go to Australia, start preparing with clear mindset. Pathology is excellent in that case. That you want to do pathology and go abroad. Choose a country. Start from day one. That what I need to do to get there, and start from the day one of your picking up MD pathology. You will really have a better life than surgeon or a
True.
medicine expert
I
or
totally
anybody.
agree. Yeah.
Again, I cannot stress on this enough. If you have a clear mind and if you want to avoid patient contact or if you want to avoid emergency, pathology is an excellent branch.
Super.
Re- Better than radiology in many aspects because going through radiology to nations abroad, developed countries is difficult. Pathology would be easier,
Easy.
and the money is same. And the money is same.
Correct. And usually in surgical specialties and our technical specialties, we get de-skilled when we go to Middle Eastern countries or other countries.
Exactly, sir. Yes,
Pathology
you
is not
will.
a big deal. We can actually we upskill also by technology.
Exactly, sir. Exactly. Because you can do all the course of pathology are present everywhere.
Mm.
Whereas being you neuro anesthesia, like even if we take example of Saudi Arabia, there will be like hardly 10 hospitals which will be able to support it.
Complexity will not be there like what we do in India.
Exactly. Exactly. So, so you are at the epitome of your field right now.
Yeah.
Neuro anesthesia is as narrow it can get now.
Yes, yes, yes.
And that makes the choices also as narrow as this.
Yeah, my choices are very less. I told you, in the call we had. So that is that is a different subject that we have to cover the
Exactly.
subject
Exactly.
video, I think.
Exactly. But again, if you are clear with your choices, you're
Yeah.
going to be happy. As I gave example of my friend in my MD biochemistry, he's much happier than me. He's in Dubai right now.
So
So
then again, coming back to entrepreneurial path. Okay, little bit. So to close the video, the last 5 minutes, I think we'll talk about entrepreneurial path. So you told you continuously emphasizing second generation multiple times. So what exactly you mean by second generation?
exactly, sir. What I'll do. When you are a second generation doctor and you want to pick up pathology, for example, if your first generation has already are in hospital or they have a practice, or your father is MD medicine, or your mother is a gynecologist, or something like that, or being a second generation doctor, your parents are just faculties in medical colleges and they don't have their own setup, what I mean to say. First of all, the choice becomes more informed. Second, when you start up as an entrepreneur in pathology, the biggest thing you need is a clear idea of where I want to establish, in which city I want to establish. And secondly, do I have a network of doctors there? When you are a second generation doctor, the biggest and the best thing which you can get to start is the network of doctors which is already present
Wow.
because of your parents or because of your being second generation. And that network of doctors will give you such a jump start that you cannot imagine.
Got it.
Like
Got
your 5 years of journey will be cut off. The
oh,
starting 5 years of your journey will cut off. And that is a big jump start.
got
If
it.
you make that informed decision and utilize it properly, then you're golden. You're good to go.
So it is not about how many samples can be done by a machine. It's about how many samples are coming to you for analysis.
Exactly. One pathologist establishing a good lab can handle 3,000 samples also per day.
But whether they're
Can
coming or
handle.
not is the question.
Whether they are coming or not. And being an entrepreneur, that is the whole story. Whether they are coming or not.
It should always be above the operating cost. The positive cash flow should be maintained.
It's absolutely has to be. And always, when you're an entrepreneur, you have to keep up with the new technologies. You have to upscale all the time. You have to improve, and which requires funding all the time. Being a second generation doctor helps in that also. Helps
Super.
in that.
So, but as an entrepreneur, comparing entrepreneur's life to a job life, how difficult this would be? Like how many X times this would be difficult?
If you are a first generation, 100 times. 100 times more difficult. Really, no sugarcoating it.
Okay.
Because in today's and also depending on the place where you're operating. If
Mm.
you are a first generation and trying to operate in a metropolitan,
Mm.
100 times more difficult.
All right, and what?
If you are a first generation trying to operate in a tier 2 city, okay, it becomes easier. If you're in a tier 3 city, becomes much more easier.
Okay.
Much more easier. But again, as compared to job, it always, entrepreneur journey always remains tougher. When I started, when I discussed with any of the seniors I had, and as soon as I said, yeah, I'm doing this, and eyes went bigger, and they were like, oh, what's the decision? And I was like, is it really so scary? And I had no advice. I really had no advice. And by the grace of Almighty, when I started, it went really, really good also. We got empaneled in 2 states. And it was COVID with which I started, and that had become my expertise by then. I had good exposure of startups. And when I joined Tata 1MG, that was also a startup. I established it, and Suraksha also a startup. And I had good experience of startups. So having that base knowledge, the era of COVID, my expertise in molecular, all combined and gave me a good start.
Mm.
But that good start, I never knew, again because of lack of guidance, that it won't last. This entrepreneur journey is always, you have to always be on your toes. The moment you relax in your chair, you start to go back. And when COVID is over, now you come to routine normal pathology, and the molecular pathology part is gone because it is still not mainstream. It is coming up. It is high capex. It is like radiology right now,
Yeah.
molecular part. So the routine pathology is very tough. And in metropolitans, when you have to take head on with all these corporate giants of pathology, it becomes exponentially difficult.
Yeah. You're
So with
competing
that,
with all the Tata, I mean, all the big
exactly.
Malpath labs
With
and all this.
with infant with it, they have infinite finding. You don't. You don't. So that becomes a challenge. You always have to keep in mind if you are a pathologist, if you are taking up a pathology and you are first generation and still you are thinking of going entrepreneurial, my advice would be straight. If you are from a tier 2, tier 3 city, good for you. Go back there, start there. And the way to do there is slow, consistent, earning the community or the people's trust in a small place is very much easier.
Yeah.
You can make yourself known that I am an MD pathologist. I'm sitting here and I am doing this good level of work.
Yeah.
And if you are good and if you are doing good work, you will be known. The best example I would give young pathologists, young aspiring pathologists, is Dr. Roy Chaturvedi Lab in Kolkata.
Okay.
Please go Google it. You will find it a very good example. He was a standalone in a different time, but a standalone in a city of Kolkata, and he's still a benchmark there.
Got it.
These kind of things are doable.
Your recommendation is first start small in tier 2 or tier 3, one center,
Yeah,
prove your worth and your capabilities there, slowly expand to
slowly.
another center. Understand.
If you are a first generation, yeah,
Got it, got it, got it.
always.
I think we covered a significant part. I think this kind of insight only entrepreneurs can give, I think, what you have given in this video.
Yes, sir. The real pain, it is never made public. It is,
Yes.
the real what it takes is never made public because it's very limited. This is a very risky decision. It
Yeah,
is a very risky decision,
because very
and
few people, yeah, very few
it is a
people.
tiring decision. Yes, it is a tiring decision as well. It always keeps you on your toes, and
So,
at
but
one point of time, it is
no, no,
overbearing.
I think see some people will want that. See, you even now, if you want, you can go to Saudi and take that job if you really want to. Correct, no? So,
Exactly, sir. And for the people who want that, again, make an informed choice.
mm,
Don't be in a fantasy or a delusion that as soon as you open up, the money will start to flow in. No, it will never.
you have to start slow. It's more like my YouTube channel only with 100 subscribers. We started slowly in 4.5 years. We are in
Exactly.
40,000 now. So,
40,000.
so
Exactly.
then slowly,
Exactly, sir.
it's step by step we have to take. That is what you are trying to tell. Got it. So then, thank you, Dr. Asif. I think this video will, change the perspective of many, many, many NEET PG students, and a lot of people would join MD Lab Medicine bar Pathology after watching this video. And I think you should be a mentor for such kind of people. Maybe you can start your own YouTube channel. That is my suggestion to you, and start mentoring only exclusive to lab medicine pathology students and all that. That will be a good starting point for your this thing also. Another entrepreneurial path.
I'll surely consider that, sir. Thank
Mm.
you for the advice. And thank you for letting me be the part of it because now I can see that if someone gets this much information
Mm.
while they are choosing pathology or are in their first year of pathology or in their MBBS and planning what to choose, again, to the MBBS graduates, I have a message that pathology is an excellent choice, provided you make it with information and conscious.
Yes. Thank you. Thank you very
You're
much.
welcome, sir.
Thank you all for following the video till this point. And if you have any comments or anything, please put in the comment section, and we will do a Q&A session after 6 months or a year or by next year counseling time. Thank you. Thank you all. Thank you very much.